Very excited to be here at JADPRO Live. Uh, Realistically, I'd love attending these types of meetings simply because I think when we get together, we all realize that it's a main fight that we're all involved in. And to be a part of it and participate in it definitely makes a world of difference and makes my day. I've been an oncologist for over 20 years, and nausea, vomiting, emesis, whatever you name it, has been the biggest difficulty for most of my patients. When I initially started managing patients with chemotherapy, that was the biggest hurdle that we had to cross, mainly because our patients suffered so much before getting chemotherapy, at the time of chemotherapy, and afterwards. So it has been really my mission to make sure that none of my patients struggle with chemo-induced nausea and vomiting, because I think it should be a zero policy or no tolerance policy. No one should really, in this day and age, suffer from nausea and vomiting, let alone end up hospitalized from dehydration, etc. So it's one of my missions in life to make sure that all the wonderful chemotherapy agents, targeted drugs, immunotherapy drugs that we are developing on a daily basis are given appropriately, and these medicines end up doing what they're meant to do simply because the patient is not throwing them back up. Yes, most definitely. I have struggled a lot with patients that get chemotherapy and then they struggle with nausea and vomiting. And I've felt that if you could forego the path of oral intake of a medicine, and if you can forego the path of getting an injectable or an IV form of medicine, you end up having a patch or a transdermal approach of antiemetics. And it has made a world of difference for me, specifically because a lot of my patients that do come in for chemotherapy, first and foremost, have the pre-chemotherapy anxiety. They look it up online, they hear about all the nausea and the vomiting. Quite often, patients cannot really swallow anything, specifically in cases of head and neck cancer, gastrointestinal cancers. So having a transdermal approach 24 hours before you even start their treatment really gives you a head start. So I have developed this protocol in my clinic where I ask my patients to consider using a transdermal patch like Sancuso. And what happens with that is that as soon as their treatment starts, then I'm not at the mercy of not knowing if the medicine worked or not. So it gives me the 24-hour backup plan of, okay, your patient is going to be able to tolerate your medicine. They don't have to swallow anything. They don't need an injection. And you know for sure, at least you gave them the best treatment available, and it's going to have a chance to work. I think antiemetic selection is really the most important part of any regimen. Going back to my training at med school, and then when I got into my oncology fellowship, we used to have steroids as our backbone medicine that we gave everybody dexamethasone. And that was really good, and it helped a lot of patients. As time went on, we started with the class of ondansetron and or 5-HT3C. And to be very blunt with you, I feel that if you give a patient the appropriate type of antiemetic ahead of time, by understanding the chemical you're giving them, you can really make this a pleasant experience as much as possible. There's not a whole lot I can do for alopecia. There's not a whole lot I can do for sepsis, septicemia, etc. But there's a lot I can do for nausea. So what I try to do in all my patients is, besides giving them a patch that I think makes a world of difference, if I'm giving a patient a chemical such as a platinum compound or cisplatin, I try to make sure that they are getting at least 2 to 3 other agents, including steroids, as well as other drugs that are available in the market. And this way, I have the guarantee that they're able to tolerate the medicine and get the appropriate results.